What is intervention radiology? A lot of students ping me on Instagram and on Twitter, ki, sir, we are taking radiology because we are interested in pursuing intervention radiology later in our careers. But many of them do not have a lot of idea what kind of procedures an intervention radiologist does. So in this video, I'll talk what intervention radiology as a subspecialty of radiology is, what kind of procedures, the whole gamut of procedures we are doing in intervention radiology, what for what people is this branch suitable, whether you should pursue it or not, and finally what are the pathways to pursue intervention radiology in your career after you have done your MD. So just a brief introduction about me. I am Dr. Rishabh Jain. I've done my MBBS from AIMS Delhi and my MD in radiology from PGI Chandigarh, and I'm currently pursuing intervention radiology in Delhi. So this is an image, this is a picture of me assisting my senior in a mechanical thrombectomy for an acute stroke patient. The patient had come within the stroke window period of 6 hours. So we did a mechanical thrombectomy for his large vessel occlusion. And as you can see beautifully that post thrombectomy, the left MCA is completely canalized. So this is one of the procedures that yes, we do in intervention radiology. This is called a mechanical thrombectomy, and it is like a life-changing procedure for a acute ischemic stroke patient. So basically what we do, we put a very thin, fine wire. So it is 018, it is 0.018 inch a thin guide wire that we put into the artery. We go all the way into the brain vessel, the middle cerebral artery, and through a catheter and through a stent, we retrieve the clot. Okay, so we retrieve the clot, and that's how the acute thrombus in the artery gets relieved, and the patient on table starts moving his or her limbs. So this is one of the procedures that we do. Now, coming to what is intervention radiology. So yes, it is a bridge between imaging and various procedures. Now, what kind of procedures are we doing in intervention radiology? So one of the procedures is a large vessel occlusion mechanical thrombectomy. So intervention radiology is a minimally invasive surgery using a very one less sub-centimetric incision. We put an incision into your groin, and through that groin we put in catheters, sheaths and guide wires to assess various vessels of the body. So yes, in general we are treating diseases of the vessels, so mainly acute bleeders, acute thrombosis, various aneurysms. So we treat various aneurysms. For example, this is one of the image wherein during my MD I saw DM neuroradiology residents treating a basilar top aneurysm. So this was an aneurysm at the junction of the posterior cerebral artery and the superior cerebral artery on the right side, and you can beautifully see that post coiling the aneurysm has totally disappeared. So instead of opening up your skull and clipping it through via neurosurgeon, we in intervention radiology go endovascularly and coil the aneurysmal sac without opening up your skull. So this is one of the most fascinating surgeries that you can see in medicine happening. Now, to name a few, what kind of procedures? So from head to toe, there are a whole gamut of procedures that intervention radiology does. For example, in stroke, you get an acute stroke and there is a large vessel occlusion in your brain occluding the blood flow. So we take the wire and retrieve that clot. This is known as a mechanical thrombectomy. For example, if you get claudication in your lower limbs, there is atherosclerosis, there is chronic smoking and angiitis obliterans. So we open up those vessels using a guide wire and a stent and a balloon, so as to restore the blood flow into the lower limbs. In liver, there is a whole gamut of procedures that intervention radiologists do in liver. For example, for treating liver cancers, we have TACE, STARE, various tumor ablation techniques that intervention radiologists are doing. In brain hemorrhage, for treating subarachnoid hemorrhage caused by aneurysmal bleeds, we do endovascular coiling of the aneurysm. Everything without opening any skull or doing any incision on the body, just a sub-millimetric incision in the groin. So for example, this is a mechanical thrombectomy that is being done. So in the first image A, you can see that there is acute cut off of the right middle cerebral artery, and then we put in a guide wire, cross that narrowing, and then retrieve that clot. You can see in this image such big clots are being retrieved by this stent retriever device. And post thrombectomy, you can see very well that the flow has been recanalized in the middle cerebral artery territory. So this is one of the most fascinating procedures that you will see in intervention radiology and in medicine. So for example, the second image is that of a transarterial chemoembolization. So we have hooked the celiac axis, and through the right hepatic artery we put in contrast, and then we see these big tumor blushes in the whole right lobe of the liver. So through this very small catheter, we put in chemotherapy into these tumors and ablate them. Now, for example, if you develop portal hypertension, in chronic liver diseases who develop portal hypertension, there are recurrent variceal bleeding, there is refractory ascites. So we intervention radiologists put in a TIPS stent, that is a transjugular intrahepatic portosystemic shunt, which basically connects your IVC to the or your hepatic veins to the portal vein and restores the blood flow across the liver, thereby reducing the portal pressure. So this is one of the very good procedures that intervention radiologists are doing. So here in the first image, you can see beautifully this stent being deployed between the IVC and the portal vein, thereby reducing the portal pressure. If you have a recurrent hemoptysis, a life-threatening hemoptysis, intervention radiologists go into the bronchial artery and embolize it so as to prevent the recurrent hemoptysis. Now, whether you should consider it or not. So, if you miss clinics, so if you have taken radiology or you're planning to take up radiology and you feel that I'll miss on clinics, I'll miss interacting with patients, I miss doing patient care directly. So I'd say intervention radiology will really fulfill your passions, really fulfill your desires. And it's a very fulfilling branch, especially when you see your intervention making a difference to the patient. And IR intervention radiology provides you with the direct opportunity in this case. IR procedures are also minimally invasive, and your patient gets discharged very quickly unless there is a complication that occurs. Now let's talk about money. So is money in intervention radiology huge? It's like never ending. So unlike popular opinion, in the initial years after you have done your fellowship or your DM in intervention, the money might be the same between IR and DR because you don't get a lot of referrals immediately. Referrals building take time like a clinical branch. So it is essentially a clinical branch now. So referrals will take some time. It will take people time to recognize you, and you'll slowly build up your practice. And so its path is gradually on the lines of any intervention branch like surgery or an intervention cardiology, etc. So you have to be a little patient if you are pursuing intervention radiology. At the end, I would like to say that IR procedures are one of the most fascinating aspects of medicine, and the feeling of seeing the patient move his or her limbs on the table after you've done a mechanical thrombectomy, believe me, it's very fascinating, it's very satisfying. Now, how to pursue IR if you are interested in it? Now, there are various fellowships. So there are 4 routes through which you can practice or your train in intervention radiology. So first is fellowships, DM, DNB, and finally some SRships as well. So coming to fellowships first, there are a lot of fellowships that FNB, the National Board Fellowships are there, which put you in either 1 or 2 year fellowship in various hospitals across the country. You can check out the FNB website or the DNB website, and you'll get to know which colleges have fellowships through the FNB exams. Now, AIMS itself has 2 intervention fellowships, mainly a GI intervention fellowship and a chest intervention fellowship, which require a 3-year SRship for you to be eligible. There are a lot of private fellowships as well across India. So Gangaram has one, ILBS has one, in South HCG has one, Medanta has one. So there are a lot of private fellowships that various big hospitals offer. Many of them are 1 year, 2 year, depending upon what kind of fellowship you choose. Now SGPGI also have 2 intervention fellowships, namely in 3 intervention fellowships: neuro interventions, vascular interventions, and GI interventions. And again, Tata has also intervention fellowships, which is mainly focused on intervention oncology. And unlike popular opinion, there is DM also after radiology. So there are 3 DMs that are available. So neuroradiology, cardiac radiology, and intervention radiology. So these 3 DMs are available either in INI-CT, so AIMS, PGI, JIPMER, Sri Chitra, NIMHANS. They have DM programs in intervention radiology, and a lot of other medical colleges take DM candidates through NEET SS. Now DNB intervention is also a 3-year course, and admission through that is again through NEET SS. So KMCH, Mangalore, Coimbatore has a very good intervention radiology program. Tata Memorial has a good intervention radiology program, but these are 3-year intervention programs. Now some SRships also provide good hands-on for intervention cases. For example, AIMS has a very good SRship program where you get to do both vascular and non-vascular stuff. Maybe not as much as compared to a DEAM or a fellowship, but if you're planning to do both IR plus DR later in your life, then doing an SRship which provides you with a decent hands-on in vascular non-vascular along with a DR SRship is a good option again. So intervention radiology overall is a very, very fascinating branch. It is, in my opinion, one of the most advanced field of medicine currently. And if you're interested in intervention radiology, you should definitely pursue radiology as your career. Thank you and have a nice day.